Every year, more than 500,000 people file for bankruptcy, according to the American Journal of Public Health. 44% say medical bills or loss of work due to illness very much contributed to their bankruptcies. Do medical procedures have to be so expensive? Maybe not. Chief photographer Stephanie Nolte introduces you to a Norfolk doctor working to change the way we pay for health care.
In the room. Everybody concur with the plan? All right, let's dance.
Dr. Demetrio Aguila is a world-class surgeon specializing in nerve pain. He served 22 years in the Air Force. As a combat flight surgeon, Dr. Aguila's duties brought him to Korea, Japan, Iraq, and Afghanistan.
A sense of fulfillment that comes from doing humanitarian work, knowing that if you don't do it, it doesn't get done. When I was in Afghanistan, I was the only head and neck reconstructive surgeon in the entire country.
Even after leaving the Air Force, Dr. Aguila's heart was still with mission work.
We can't ignore the people in our own backyard.
Today, Dr. Aguila volunteers at Orphan Grain Train in Norfolk alongside his patients.
They're more enthused about doing the project because they have another purpose.
Well, it's groundbreaking. I never heard of anything like it.
The patient comes in and we offer them, well, you can pay for your surgery this way, or you can invest in yourself through volunteer time.
M25, named after Matthew 25:40 in the Bible, is a program Dr. Aguila started 6 months ago.
I don't care if you're a multi-billionaire or if you're the guy on the street corner with a styrofoam cup. You get offered the same options. Why? Because it's fair. And then the patient decides, what's more valuable to me? My time, my resources, or my problem?
Dr. Aguila says he has a complex algorithm to determine service hours versus funds, and then the patient decides.
The program's designed in such a way that a certain percentage of patients will find it more reasonable for them to spend their funds, and a certain percentage of patients will find it more reasonable for them to spend their time.
560 hours is a lot of time, especially when you think small and you think, how am I going to put in 560 hours? I mean, that's literally 14 weeks of full-time work.
But he got it done. More than 100 people put in service hours for Jeff at Orphan Grain Train. His surgery is scheduled for the first week of February.
I'd have been paying for this surgery for the next, 5-6 years. It's the cost just for Dr. Aguila, just his cost is the cost of a good used vehicle.
Dr. Aguila is extending the reach of his community service through his patients, all while giving them back control of their health care. An alternative to money he hopes more physicians will consider. In Norfolk, Stephanie Nolte, 3 News Now.
What an incredible idea. Least of My Brethren, an organization that helps homeless in the Omaha area, just signed on to be an M25 program volunteer site. The organization is looking forward to gaining more volunteers with the doctor's help.